Good morning and welcome to Gator Gossip. We are here, and my son in the last episode said, we know how excited you are to interview Dr. Tierney, and they were just so happy that I was able to come here. So we're here with Dr. Cheryl Tierney, and we have a lot of information that she was willing to sit down and talk with me for a little bit. Typically, this is the type of information we have to make appointments for and wait around for, so we're super excited to be able to just get some information.
Great.
Would you like to introduce yourself?
Yeah, sure. I'm Cheryl Tierney. I'm a behavior and developmental pediatrician, and I've been practicing in Pennsylvania for almost 14 years now. I started my career up in New England and was practicing there for over a decade, and then 14 years ago, I decided to relocate to central Pennsylvania, where I have been practicing developmental medicine for that entire time.
Yes, the whole time, right?
Yes.
And where were you at prior? Did you work at Hershey?
Yes.
Hospital?
Yes. So
Okay.
my position when I relocated from Massachusetts was at the Hershey, Penn State Hershey Medical Center, the Children's Hospital, and I was and I continue to be on faculty there, and I still see a few patients there, but mostly the last year and a half, I have been with a company called Meliora Health.
Yes.
And we do virtual diagnostic evaluations for children suspected of a variety of neurodiverse conditions, autism being the most common and ADHD being the second most common. And then we also provide some support services for like common problems that families will have. Yeah.
So I was very excited when I saw Meliora come about. It's virtual, it's diagnostic, and it does yield possible diagnoses.
Yeah.
They are virtually, and I don't want to say this, so that's for you, no waiting lists.
Right.
If they are, they're minimal or there aren't any.
Right. So it's not that we don't have any waiting lists right now. I mean, part of the reason why I transitioned from academics to Meliora is because I was really getting frustrated with how long families were waiting for access.
Yes.
And I had that same problem in New England. I had like an 18-month wait list when I left there.
And that was
years ago, many years ago,
Yeah.
right? And it got a little better here. I think 9 months, and some families waited up to a year, but that's just like not acceptable, and it's not necessary.
Yeah.
I knew that if we had the right resources and the right game plan, we could do this better. And then the pandemic hit. And we had to provide care virtually almost overnight, virtually overnight. March 2020, it was really
different.
everything, the whole ballgame changed. And so at that time, I started doing some kind of moonlighting for myself virtually in other states because I was practicing in person here. And the parent company, Helios, which is also a virtual diagnostic evaluation.
In this state?
So it's in the UK, in the United Kingdom, and the UK, and they are the largest virtual offering for diagnostics in the United Kingdom, and they are they're amazing. They have been in practice delivering this kind of care for over a decade.
Oh, wow.
So it had nothing to do with the pandemic.
Right.
Like they were really just very forward thinking.
Right.
And they approached me and said, hey, could I consult with them for a little bit? And then they brought me on as the medical director and now the chief medical officer.
At the one in the UK?
So we are the U.S. subsidiary.
Got it.
So basically, we're the UK's experiment, so to speak.
Okay.
Can this happen in the most confusing healthcare environments in the world, right? In the United States. So
Very much.
So I consulted for a while and then decided to take it on full time and really try to impact that weight. And so that we wanted, our mission was not to sacrifice the quality or the expertise or anything about what you should expect to get the same quality. But you don't have to wait. And so while it may take a little while to get insurance authorization and families have to fill out an intake packet, once they complete the steps, they're scheduled right away. And it's scheduled within a few weeks of that call. So it is virtually no wait. Yeah.
Now, I've referred parents to you,
Yeah.
to the company.
Yeah.
And it's funny because I don't know if you probably can, but in regard to insurance, on certain occasions, you even take Medicaid.
Yeah.
There are certain occasions where you actually take the Medicaid.
Yeah. So we are very mission driven. Like we
Yeah.
don't want access for families only that can afford to pay, or
Right.
for families that have private insurance. I've always, my whole career, been very involved in advocacy work, and
Yes.
the underserved is a really important population to me.
Yeah.
And so, yes, taking Medicaid is very important. Of course, in Pennsylvania, as you can imagine, dealing with Medicaid isn't easy. So we are slowly getting our way through. So it depends on what county you live in at this point, but there are definitely quite a few counties where we do take medical assistance.
Philadelphia, one of them?
Isn't. So CBH has been saying that they have enough providers in network, and we've had a hard time. If you live in Philadelphia County and you want to give CBH a call and tell them that they need access and they should contract with us, we'll take any help we can get. They can reach out to us and we can help them with how to reach out to CBH. But we can see kids in a lot of other counties, and I suspect that over the next few months, there will be the Department of Human Services and the Office of Mental Health and Substance Abuse, OMSAS, is going to make some changes to their guidelines for what they will allow to be delivered for Medicaid. And I think that those changes are going to be crucial for families with Medicaid to get access, because we don't want this to be something that if you only can afford it. It's really not.
It's very expensive.
Yeah, I mean, we try to keep if we don't take your insurance, we try to keep our prices very reasonable so that families can use their healthcare savings.
Okay.
And we can do a payment plan up until being seen.
Oh, wow.
And we really are trying to be very competitive. In fact, we just recently lowered our prices to make it a little more accessible. So whereas other companies are raising prices and raising prices, we're really trying to look at our bottom line and keep it as affordable as possible. Yeah. But we do take almost all private insurance, including TRICARE. Yeah.
Oh, wow.
Yeah.
So for those of you who are waiting, this is honestly something I would look into immediately, because there's still long wait lists. And I think in the interim, parents are losing crucial time to get services, and to get services, we need the diagnosis.
Right.
So it's hard to get that done, and that's what I'm finding. We're having more and more kids come into a preschool who have no diagnosis. So it's hard because then I can't provide them
with the services, right?
I can't provide them anything.
Right. And families then also are struggling to understand why their child's acting a certain way or behaving and how to help them. They just don't know. I really appreciate that plug. And I will say that one of the things that I have seen and been a little nervous about is that other online offerings, like this is how parents going to know what's quality versus what isn't. And the one thing that was really important to me is that I think it is a really, I believe that primary care doctors and your pediatrician should be able to diagnose you if your situation is very straightforward and they know your family and they know you and they feel really comfortable. But what I have been seeing more and more is individuals getting kind of quickie trainings on one tool, and then just applying that one tool and then saying your child has autism, and then also doesn't look for all the comorbidities and doesn't address all those things. And so it is it's a Band-Aid for a bigger problem. And I think in some circumstances, I understand families really wanting to get access and to get their child assessed, but here at Meliora, we really care about not just getting you in quickly, which is very important, and we have been achieving that, but also having providers who have actually gone to school and have training and expertise to look at these conditions, look at all the comorbidities or the conditions that can occur together, and help families understand the whole picture of what their child is struggling with, not just whether your child has autism, yes, no. and may not understand the impact of trauma, or may not understand the impact of ADHD or anxiety or depression or other mental health challenges, and how that all may make your child's symptoms look different, and then how to adjust what you're doing to help them improve because of these factors that really do impact how you're going to approach treatment. And so none of our providers who come to us have never diagnosed autism before. They're all people who have worked in this space in person and now want to be able to expand access virtually online.
Yeah. Do you use, and I'm sure you do, so like none of the people at my preschool or, you know, the BCBAs that we have and the clinical team, obviously we can't diagnose. But we do use like the CARs or the GARs and the ABAS and all those things.
Yep.
I've gotten many reports back and they have no clinical assessment to them. And so a lot of times parents will come in and they'll hand me a paper and it will just have nothing really on it. There was never an initial diagnostic assessment really, and it'll say autism. And we hand that into insurance and stuff and they don't usually accept it.
Right.
So when you're looking for a test to assess for autism or ADHD, what should you be looking out for when selecting that person? What should you be seeing during your assessment, so to speak?
So for almost 25 years of practice, I've said this so many times, so I could do this in my sleep, of course. Any assessment should include several aspects. There's multiple things. One is a detailed history. So, and it has to be comprehensive. So looking at all aspects of your child's development and medical conditions that can also co-occur with this. So you're looking at their medical history, their developmental history, their behavioral history, and that history should take a little while to obtain.
Yes.
If a provider asks you questions for a few minutes and that's it, I would question like how thorough were they in really gathering all the information needed. So a detailed, comprehensive history. The second is rating scales that are standardized. And the reason why rating scales are important is because they have been normed in a scientific way so that the questions are asked in a certain way and validated in a certain way so that when we look at the results, it compares your child to kids with and without the conditions.
Right.
And so it gives us another snapshot of symptoms using a standardized tool.
Okay.
And then direct testing.
Yes.
So that third piece is important. So some skilled observation and scoring of a tool. So for us, for example, we use the Tele-ADAS DPs, which is out of Vanderbilt. We modified the ADAS, so that is a tool that's been utilized. We use the CARs. And so it depends on what your child presents with. If there's a concern at all about emotional co-occurring conditions like anxiety and depression, we add tools for that. If there's a concern about intellectual disability, we may use an adaptive measure like
so
an
you're not just using the autism assessments. You're picking up on what may coexist with it or comorbidity. And then further assessing those.
Correct.
Okay, because that I don't really see.
Yeah, correct. And that's why, because your approach, you know, there's the yes or no to this one question of autism, but then if your child has anything else, if you don't do a deeper dive into, that's why that history is so important, because I mean, some kids don't have any other current co-occurring conditions, and that's fine, and that's great, but that's not frequent.
We see just usually autism at the age that they are, 3 to 5. And then we also see ADHD. And for us, that's it. And then it's difficult because there are different, like OCD or something like that. There's so many different things to have.
There are obsessive behaviors that can either co-occur with autism, that's a symptom, or it can be a standalone diagnosis. Anxiety and depression, learning, developmental or global developmental delays, speech and language delays. I mean, there's a lot of things that you have to take into consideration and might influence what you recommend. So, and that's where those recommendations I think are so important.
I've actually, and I don't know the name and I wouldn't say it anyway, but I just want to tell parents, because the platform that you're using is like a unicorn, you know? And it doesn't surprise me that you had a part in it. So
Don't mind this part. There was a small blooper that I needed to get out of there. I lost my train of thought and didn't want you guys to have to hear it.
So again, we won't name names just because it's something that I don't want to put out there, but because your platform is so fantastic, I want to point out there are other ones like you mentioned.
Yeah.
But there are other ones currently that are advertising to pay the parent to be the RBT. And so I don't know if that's something that you would say look out for, or if that's something where you would say that's an okay thing to pursue, because personally, I feel like that's a conflict.
Yeah. I mean, parent training is important. Don't get me wrong. I think we would be like-minded on that. I know for sure. Parents need to be part of the treatment plan, because ultimately you're with your child all the time, right? Mm-hmm. So if only the treatment team knows what to do to help manage your child or get the best out of them, think about all those hours that they're not with their treatment team, right? But so there has to be an element of parent training. And often I feel like that piece is missing from some, right? Or that families are working and the treatment is happening in a center. And so there has to be some element to try to loop those parents back in, right? Because there's your child's long-term outcome is going to depend on you having skills, right? But there's a reason why people go to school to do this and do what they do and get a master's degree or have a certificate training, is because, and then lots of experience working with a variety of children. I mean, this is how I also, I've been talking this way for so long, is that, you during the pandemic, many parents had become teachers, right? Their parents' teacher. And I heard this often. I'm not a teacher. I didn't go to school to become a teacher. I don't know how to teach my child how to read and how to do the math. And of course, because the teachers go to school for that, we have a increased recognition, appreciation for what teachers do. Of course. But you realize how hard that was. And the same thing, now apply this to a very specialized area. Like there's a reason why people become professionals in these areas, because there's a lot of expertise that's required. We use, and I hate to keep bringing this up, but obviously I know what we do. For parent training, we do it weekly. And we found a few things that were super helpful, and parents can even purchase these only because it's made for parents. Oh man, I wish I knew it. It's an ABA illustrative book. So it just shows the parent what's play. How do I get to know my child? Because we're finding we do in-home as well. For like once a month we check in. And what we're finding is a lot of parents, they don't even really, and it's not their fault, but they don't know how to play with or relate to their child. So there's nothing occurring, and obviously play is really important to learn. And so this will teach you how to play with your child, because I find that important. So do you think that that's something we should? Especially for young children, play is how you learn. I always, when parents say, I don't know who comes to my house, they come to my house every week and all they do is play with my child, right? And I try to explain that play is the way your child develops their cognitive skills and learns. And so it is so important to develop good play skills, that foundation of joint attention and shared learning and creativity and imagination and flexibility and representational play. All these things will pay dividends later if we get those skills in place early. And so there are quite a few books out there that I also will recommend to families if they're interested, that teach these skills and why they're so important. ABA every day, like how to engage, how to play, how to set up the environment. Absolutely, I totally agree with you.
I remember bringing my twins to an actual play therapist in I think it was Bell Kingwood. And I remember him yelling at me nicely, because when we started playing, I initially directed the play. And so he was like, stop it. He initiates play. So I feel like those types of things, you just it's not comfortable, and that's okay. At preschool, you have to be silly. You have to not care that other people are watching you roll around and act like a dinosaur on the floor. And that's where we see, like, for us, communication just coming out.
Yeah.
And it's just great to see.
Yeah.
So,
it's amazing how many parents, it's not natural.
it's not.
Right? So don't feel bad if it's not natural. It doesn't make you a bad parent.
Yeah.
You just have to learn how to do it. And having that support is really important.
Mm-hmm. Right. You're not a bad parent for
Right,
that.
definitely not. But it is important to learn how to do it and be open to learning.
Yes. Yeah. That's just crash past the barriers. I'm also, and I really wanted your take on this because it's a lot of like speech and language type things. I run into a lot of parents who will not use the either AAC or PECS at home, and they just want to use it in school. Same thing with Chewies and stuff. Not ever at home, just in school. Will that skill of communication that's being used in the school ever transfer into home, if that's the case?
Yeah, so again, you're asking questions like, so funny, very, very common question. You don't leave the house without your voice, right?
Yeah.
And you have to be able, to be able to interact with others, you have to be able to, we have to try their best. I'm not saying that there aren't some kids that are going to really struggle in this regard, but to the extent that a child needs alternative or augmented communication strategies to help them be more effective communicators, it is important to make sure that those tools are used everywhere the child goes. So I call it their talker.
Yeah,
right? And so when kids come to the office and I know that they have a device they're using, I'm like, where's your talker? And then oftentimes I hear in the car or at home or at school. And my answer is that we have to do our best to integrate it in every environment, because think about for yourself, like if you could only communicate in one setting, how frustrating that would be, and behaviors will escalate. So the problem is that you'll have a child kind of be trapped and not be able to communicate, and then have externalizing behaviors or outward behaviors because they're frustrated, and that's a shame.
I agree. And it's like a touchy subject.
Yeah.
Because I think a lot of times it has to do with acceptance of a diagnosis that they don't necessarily want to accept, whether it be just, a personal issue, a cultural issue. It's difficult.
Yeah.
You don't want to step over that boundary.
I also hear a lot, a myth that I'll dispel.
Please do.
Is that if they use that device, then they won't learn to talk.
Yeah.
And research has been so clear on this, that using a device or PECS or whatever your system is, in all settings and being really consistent with it increases the chances your child will learn to talk. It won't decrease it. It's because you go to the path of least resistance. Yeah. Everyone does that. It's human nature.
Yes.
Why would you go to a device, flip through screens, pick icons, when you can just say it out your mouth? It is so much less work to do that. And so once the skill, the words are there, they will use their words. Right. So we're not trying to ask them to use these alternative means if they do have the words. It's where they don't easily have the words. So it is a reinforcement and will help decrease the stress and the anxiety around communication. And once kids feel less stress and less anxiety around communication, they're much more likely to use words.
Right. That is definitely something that I see. Yeah, for sure. On that note, are there any other myths that you have to debunk that you hear often when parents come in and say something and you're like, no?
So there's probably a ton, but one comes to mind. One other one comes to mind. And this is, I don't want my child labeled. I don't want them to have the label. I don't want them stigmatized. And so they don't want to pursue maybe an evaluation. Right. And I've had this even as recently as the last couple of weeks. And it always makes me a little sad. Because the way I kind of describe it is that the world is going to label your child. People are very sensitive. Children, teachers, others are very sensitive to differences.
Yes.
And so if your child's struggling socially, if your child is struggling behaviorally, if your child is struggling with communication, any area of concern there, the world notices that.
Yep.
And then the assumptions that are made based on that observation, that is the stigma. That is the problem. That is the label that is the world will give.
Right.
If you diagnose a child early, that diagnosis is not what other people are going to then make assumptions off of.
Right.
They will make assumptions based on the behaviors that they see, your social interactions, your conversational skills, all those things that's where the stigma comes. And so the first step to getting help to reduce those behaviors, to improve their communication, to improve their social emotional functioning, to improve all those aspects, come from the intervention.
Yes.
So if you want your child to not be labeled, then, or not to have that stigma attached, the best thing you can do is get the diagnosis early.
Right.
Because that intervention, that all that added time, is going to reduce the chances that the world is going to label for you.
Yes.
So hopefully that maybe that helps put that in perspective, but it isn't what's in the medical chart. Nobody knows what's in your medical chart. No, the world isn't seeing your child's medical chart.
Right.
The stigma comes from what is observed.
Yeah, right. That's a great point. I never thought of it that way. So regardless, there's a label, whether it be medical or unfortunately socially.
Right.
Okay. Great.
Yeah, and the way to decrease that social stigma is to get the help early. Yeah. So that's a myth that I see a lot, is that if I can just avoid the diagnosis for a period of time longer, their child's outcome or the stigma will be less for them. And that is, again, the opposite of what we see.
Yeah. I almost feel the same way about parents. And again, this is just for information. This isn't judgment at all, because I'm a parent too. As are you.
Yes.
When it comes to the public school system, I see a ton of parents during that transition into kindergarten who get very, very upset when the child is placed in a very small classroom and they feel that they should be in gen ed. And so what do you think the signs may be for your child to be ready for gen ed? And of course, we would be inclusive already, and they would probably spend certain periods with the, neurotypical children. But what are some, if you have any observations you could make for children who are ready to interact with their peers in a more appropriate manner?
Yeah, that is a great question. I guess I'll start with the term that many parents have heard is called least restrictive environment, right?
Yeah. Yep.
And I think that least restrictive environment gets thrown around a lot as a reason to put kids into general education when they're not ready for general education. In fact, general education is the more restrictive environment than an alternative environment.
Yep.
Are some kids with autism and some kids with neurodevelopmental disabilities appropriate for general ed? Absolutely, of course. 100%, of course. However, the idea of least restrictive environment means the least restrictive place where the child can access the curriculum. Not just meaning that general ed is the definition of the least restrictive and everything else is more restrictive.
Yeah.
Least restrictive is the place where it's least restrictive and the child can access the curriculum. So if your child has significant needs and they're in a general education setting and there's not enough support for them to access how the teacher in that mainstream classroom is teaching, and they're not learning from that, then what the school district did is put your child in a most restrictive, a more restrictive environment. So to me, it's, are they learning?
Yeah.
Are they getting out of the instruction what they should be getting out of? And are they making meaningful peer relationships? And is that going well?
Yeah.
So I feel like those are the questions. And just to kind of reframe that whole concept of what it means to be least restrictive is often, I think, really misapplied.
Yeah. I have a cert in special ed, and I would have never put it that way. So that's really, like, that's a great way that you put it. It's definitely more restrictive in gen ed for children who don't have the skill set to learn, form relationships and things like that. So I think it's really just the parents mean well, because I've been there, and
Right, of course,
you mean
of course,
well, and you
of course.
hear, you know, least restrictive environment, and as a parent you're like, that's all I want my kid in. Same thing I see with being discharged from ABA or discharged from speech. Parents, myself, get so upset because they feel like, oh no, it's ending. I'll never get it back. Do you ever see, and it might not be your forte, but do you ever see progress? Is there a need to continue past when your goals are met?
Yeah, so I think what you're asking, let me make sure I understand what you're asking. So I see lots of kids get discharged from ABA and then go back into ABA.
Yeah.
Like they've met their goals, they're doing well, and we want to increase their autonomy and their and let them have a period of time without services because there's just not much to work on there. They're doing well, right? And then later in life, or a year later, 2 years later, there's a problem that arises that ABA would be appropriate to address. And then we would do targeted ABA for a particular concern that we're dealing with. So or to develop a skill, or to reduce or help manage a problem behavior. Same with speech. You reach a period where you've met your goals, and now we have to see if the child can keep up in that way, and how will they do, and whether or not they'll fall back behind, and then we can re-enlist those services if needed.
Okay.
So to me, it's what goals are we working on? Is there still goals to work on? And if not, then we should titrate down and discharge because there are a lot of children that need these services and not enough to go around. We all know that. And so we don't want to keep it just because. And it's not good for your child to become dependent on a support that they truly at that time don't need anymore. And then if it arises down the road, we can always re-enlist support if needed. No one says that this is a forever thing. I've seen kids go in and out from their whole childhood.
Right.
In and out. Yes.
Okay. That makes sense. Once you're discharged, it doesn't mean
It's not forever. Yeah, it doesn't have to be. It might be because that'd be great.
success.
Right. But it doesn't always mean that, and that's okay.
Right. Now, I don't know what time is it? I know you're on a schedule. Which
I'm
makes
good.
sense.
I'm good.
Okay.
You decide when you.
Okay.
Yeah.
Okay. Would you, when I first met you, it was through ABA PA initiative. It was the first time I was ever in Harrisburg and knocking on the doors. And I remember you were like, you're running around like, did you go there? Did you go there? How you just helping us, because I know I was nervous. I've never done that before, and we buddied up with people. I tell everyone, I'm like, oh man, that was such a great experience. But a lot of people have no idea what that means. So what is ABA and PA initiative?
Yeah. So in 2010, I moved from Massachusetts to Pennsylvania. And in Massachusetts, where I was practicing, it was much easier to get ABA services. It was all done by educated, skilled professionals. Mostly, it was all behavior analysts. At that time, I moved in 2010, and I remember asking my partner at the med center, where do kids, how do I order it, and how do kids access ABA?
Yeah.
And her answer to me was, kids don't get that here. And I was like, what do you mean kids don't get that here? That can't be true. But it kind of was true. There were behavior analysts out there, but not many, almost no agencies. I could copy and paste a list of 4 choices, and that was really hard to access, and medical assistance wasn't covering it, and it was really, really terrible. So
When did medical assistance start covering it? That was recent.
yeah, so that was in the late 2010s, like 2018 or so. And that was because part of that advocacy work that we had done from 2010 to 2018 was to figure out that while we had a law called Act 62 that mandated that insurance cover it. Medical assistance was in fact not really covering it at all. But they were not providing ABA the way it was meant to be. You couldn't work on adaptive skills. You couldn't work on skill building. Like there was none of that. So it was really, really terrible. And so we formed in 2010 the ABA and PA initiative in order to help kids who had Medicaid access ABA, and not just kids that maybe had a rare insurance that did cover it. And actually it was mostly kids with TRICARE that could access it back then, and nobody else. And that was because TRICARE was national, and they were providing it. And I said, how come? I remember seeing my first kid who had TRICARE, and I go, how did you get that? That is ABA. How'd you get that? And they had TRICARE, and I realized that we had to do work on this. So it was parents, it was BCBAs, it was, some professionals that were advocates. We started out in a tiny room. We grew to hundreds and hundreds. We were huge. And by the late 2010s, we realized that we needed to we actually had a class action lawsuit against the Department of Health and Human Services, and we won that class action lawsuit. It was called the Sunny O v. Dallas lawsuit. We won that. And then as a result of that, the government had to put in place the regulations. And that's where the IDHS regulations came from, for better or worse, but at least it required people with certain skill, background, expertise. And we're still fighting to improve access and the laws in Pennsylvania to better support families with autism, but it's a very time-intensive process, and we're still working on it.
How long did it take from 2010? How long did it take you to get Medicaid on board? Like years and years and years?
So it took years for us to figure out how to approach it. There were a lot of meetings with the Department of Health and Human Services, and we tried to do this very amicably and just kind of say, you should do the right thing, and that didn't work out well. So we partnered with the Disability Rights Network. And they brought the class action lawsuit, and then we helped support them with experts to testify. And then it took about 2 years. I think it was from 2016 and then to 2018. It was in that time range, a couple of years until the lawsuit was settled. And then, of course, we're still dealing with the aftermath. And then I think it was 2021 that the regulations went into effect. So it was definitely like a 5-year process.
So the IBH regulations now in regard to your qualifications, that is from
the Sunny O, that class action lawsuit.
Okay.
And look, there would be a lot. I'm not saying there's not criticism about it. Of course, we did. Nothing's perfect, but if you look back to 2010 when families were getting nothing. What that opened up was the possibility of more providers coming into Pennsylvania. Nobody would come into Pennsylvania to practice here because you could go to New Jersey and practice, Maryland and practice, New York. I mean, you can go to every surrounding state offered it. So if you were even coming out of one of our graduate programs, you wouldn't stay in Pennsylvania. You would move away and practice somewhere else. But now people who are getting educated here much more likely to stay here and practice, and then they'll become the service providers of the future for your children.
Yeah, that's great. That's awesome. I didn't know that. I was actually happy when that came out because I felt the same way. There's some people out there that were able to clinically direct or even ABA in general being an RBT, like things like that. I also remember being in a spot where I was just a BSc. And that's not to take away because I'm currently just a BSc or LBS, and thinking that BCBA is like pompous because they don't think that I know what they know. I'm in the same field. And then when I finished all my coursework for my BCBA, I was like, that's why. It's just so much more scientific. There's so much more behind it. And a lot of people, again, don't like ABA. And I found that a lot of adult autistic people have said things about ABA. So sometimes I get messages and things like that that aren't very nice.
Yeah, that's okay. Look, I also feel like not every single child needs to have ABA. It doesn't have to be. It's not like autism equals ABA.
Yeah.
That's not what we're saying. We're saying that there are a lot of families that are struggling with a lot of very significant issues, and child can't go to school, or they're getting kicked out of daycare, or they are unsafe, or there's ways of doing it in a way that's very positive and with trauma informed, and I'm all about making sure that we use a very strong code of ethics, of course. That said, an apprentice model of just kind of getting clinical experience but not having the education behind it. The analogy I give to families is, if I didn't go to medical school and I just watched a doctor work, would you want me treating your child?
Right. Nah, not really.
Probably not. No. Like if your pediatrician just never went to med school,
right,
and they just watched, and then they said they could get a license and do exactly the same thing that somebody that went to medical school and did residency and did fellowship and did training, and then those things are not equal.
No.
And outcomes for patients are different if you have somebody with more expertise. Like if you go to your general pediatrician, but you need a specialist, like a GI specialist or a neurologist, there's a reason you're going to see those specialists, because they have extra education and they understand the science behind it and the research. Same in this field. This is no different. It's a scientific field. If what Pennsylvania was doing was allowing people that didn't understand or have that education work with kids, and then we couldn't understand why are the outcomes not good? Why are our outcomes not good? Well, our outcomes are not good is because these providers don't have the education to understand. Not their fault, but they don't. And so we need to fill the field, not by lowering the standard so that more humans can do it, and then being surprised when outcomes aren't good. It's figuring out ways to encourage people to go to school to learn the science so that they can deliver better and ethical care. And that's my opinion on that.
I think that's good to say, because with the shortage of providers and doctors and specialists able to diagnose, what's in place now limits the ability for companies to pop up that have the bare minimum requirements that can fill those gaps. So we thank you for the regulations, even though that may not be
None of us love regulations. We don't, but we also don't. We also know that it helps protect the field from having people that don't have the right education. Now, look, licensure in a lot of fields gets criticized. Like, do you need a license to cut hair? Do you need a license to paint a house? I'm not going to get into other areas of licensure, but when it comes to your child's health and development, we need to make sure that there's a set of standards, because in the U.S. in general, we have a tendency of saying, oh, there's a shortage, let's lower the entry criteria to get into it. And then families are the ones that don't realize the difference, and then they will get an impression of what this is, what ABA is, that's not accurate, because they've only had experience with people that have not had the education, the training, or the experience, and then they get a negative view of it. And then so many times when we connect them with skilled, experienced professionals, it's like night and day.
Right. Different world.
Night and day.
Different world. So we'll wrap up. I appreciate your time. Can you tell us how to find both Meliora and ABA and PA? How can we find that? Because it's something that we should definitely get on board with. Parents, it's very important. I think this is something to attempt. Even if you don't think your insurance is going to cover it, it's not going to hurt you to call.
We'll check your insurance for sure. So if you're looking for an assessment, a comprehensive assessment of your child, I would start by going to our website. It's www.meliora, health.com. And on there's called the contact us form, and also a form that you can fill out if you know you want an evaluation. You fill out the get your evaluation now. It's a couple of quick questions which make sure that you live in a state, because we have providers that see kids in New York, New Jersey, Pennsylvania, and Florida. And so if you live in any of those 4 states, we can potentially see you. And obviously we're talking to a big Pennsylvania audience, and obviously that's my baby is Pennsylvania, so that's where I see kids. And fill that out and send it in, and then we will get back in touch with you. You do not need a referral from your pediatrician,
Right.
although you can certainly talk to your pediatrician, and then they can send over a request or a referral to us, because we do work with almost all the pediatricians' offices in these states. And then also for ABA and PA, again, you can go to our website to learn more. Everything, of course, go to the website, www.abainpa.com. So that's super easy, abainpa.com. And again, you can search. We have a searchable directory for ABA providers depending on where you live. It's by county. And that is probably the most popular offering on that website is our directory to find agencies that we've vetted and that they're following the regulations. So you can't be in our directory if you are not complying with regulations in there. So families can feel safe about finding an agency on that website. But if you're looking for an evaluation, we absolutely would love to see you, and you can give us a call as well. And our phone number is 1-855-675-1849.
Very good. Very good. Thank you so much. I really hope that this is utilized. I hope people hear this, listen to this. And I don't know if you have anything to leave us with, but I think that was perfect.
Yeah,
so thank you guys, and we will see you next Tuesday.
Thank you so much.
7.
1, 2.